Hey guys, my name is Dr. Mitchell Bitron. Welcome to my YouTube channel. And here today, I'm here to talk to you about your first pregnancy confirmation video. Some of my patients, specifically on the more anxious side, usually this happens maybe 1 to 2 days after their last menstrual period. They realize they're a little late. They take a pregnancy test, and to their surprise, maybe not so much to their surprise, they're pregnant. What do you do next? In this video, this is what we're going to talk about. As an introduction, let's talk about this. You got a positive pregnancy test. When do you make your next appointment? So what typically happens is a patient calls after a few days, they get their last menstrual period, they have a positive pregnancy test, they try to schedule an appointment. The first appointment usually happens somewhere between 7 and 9 weeks. Reason being is in the early part of pregnancy, specifically before 6 weeks, it's impossible to confirm viability. What does that mean? It means for us to confirm a viable pregnancy, we need to see two things. We need to see the pregnancy, and we also need to see a heartbeat, and that happens around the 6-week mark. So generally for us, we usually like our patients to come in for the first appointment, give or take around the 8th week, so we can do a few things, which we'll talk about later in the ultrasound section. Know the location of the pregnancy, that it's viable, where it is, and how many are there. So that is why we usually have that appointment made around the 8-week mark. The next thing we're going to talk about is what to expect during that first appointment. So let's get into it. So the breakdown to the appointment is usually you come in, it was your first time in the office, there's usually some paperwork to fill out as a new patient. A practitioner will either take history and physical, then we'll move forward towards the ultrasound. Because usually after the ultrasound, once we've hopefully confirmed a viable pregnancy, we'll have a chance for you guys to ask a lot of questions, and then we move forward to the lab work portion of the visit. Moving forward to the history and physical. This is a really important part of the visit because it lets us know more about you as a person. Meaning, if you have any medical issues such as hypertension, diabetes, those things tend to affect the pregnancy. And if they do, we need to make sure we manage them and control them appropriately. It also goes into, in the future, how we monitor you throughout the pregnancy and also talk about delivery planning. We also need to know, have you had any surgeries? For example, if you had a myomectomy, which is a removal of fibroids of your uterus, that may, depending on the location, preclude you from having a vaginal delivery. We ask you about your allergies. We also ask you, importantly, about your family history. Your family history is really important because if you have any genetic disorders, bleeding disorders in the family, we need to make sure we screen for them appropriately and assess your risk. We'll talk later in this video on the lab work section about carrier screening and its importance, which kind of relates to this section as well. We then take a social history. The social history is important because we need to get to know about you more as a person. Do you have any risk factors? Do you drink? Do you smoke? Do you do drugs? What is your relationship status? Do you feel safe at home? What is your job like? Do you have a very stressful job that may be impacted by the pregnancy? Do you work with any toxic chemicals which may not be appropriate to be around during the pregnancy? We then take a gynecological history. That's very important as far as dating. For example, if you have a 28-day cycle, we are assuming the ultrasound will be in line with your dating given from your cycle. If you have irregular cycles, we may expect something a little different. We need to know if you had any history of sexually transmitted diseases. We need to assess for risks for ectopic pregnancies. And we get a better sense of that through your gynecological history. We then take an obstetrical history. I'm making the assumption that this is your first pregnancy since you're watching this video, trying to get more information, but I also make the joke that if you're pregnant again, you probably forgot a thing or two. So we make sure we ask you about your previous pregnancies. Have you had any miscarriages? Have you had any vaginal deliveries? Have you had any C-sections? Were there any complications in previous pregnancies? If you had a C-section, why did you have the C-section? Are you a good candidate to VBAC? Once your full history is taken, we move forward to the ultrasound portion. The ultrasound is important for a few reasons. The main reason is to know, number one, the location of the pregnancy. We need to appropriately date the pregnancy, and then we, to some people's surprise, know how many pregnancies there are. In another video, we'll go through how dating is actually done and the differences between the weeks in the ultrasound. Hopefully we confirm a viable pregnancy and everything is fine. We then open up visit to ask questions. At this point, I have more information about you, so I think it's a good time for you to get more information about us. So the main things that we usually talk about is what are the next steps moving forward. That is something we'll also cover in another video. And then a bunch of questions that may affect your lifestyle. Can I work out? What can I eat? Can I travel? Can I dye my hair? And once that is all done, we move forward to the lab work section. The lab work is important because it lets us assess for some baseline of a few things. We need to check your hemoglobin. We need to make sure that not too anemic. We sometimes check for any specific things depending on your history. For example, if you had a gastric sleeve or if you have a vegan diet, there may be some indication to check for other vitamin deficiencies. We also do a CD screening. Reason why is that if you are positive, those things can negatively affect the pregnancy. We check for vaccine titers. We need to know if you're, for example, if you've been vaccinated or exposed to things like varicella, and check your titers for rubella and a few other things. As we talked about previously, we also screen for carrier screening. What carrier screening is a person has two sets of genes. They're basically, you have 23 sets of chromosomes together, 22 in a set of sex chromosomes. You may have a gene for something such as cystic fibrosis and never know because you're perfectly healthy and fine. The same thing could possibly be true about your partner. So if a patient comes to me before they're pregnant, I usually screen for this beforehand. But assuming that you didn't and it's your first appointment, we do this now. There's different carrier screening panels, and that really depends on what your family history is, your ethnicity, and your overall basic risk. And there's also these expanded carrier screening panels that many of my patients opt for, which we can talk about in another video. But the main purpose is is we need to know if you and your partner have the same gene, that there's then a 25% chance that the baby does, and that would require further testing. So we like to get that out of the way in the first visit, so we can take the next necessary precautions and hopefully just reassure you everything's okay. I'd like to remind people that we did many things in this visit. We took your history, did a physical exam, we did an ultrasound, we did a bunch of lab work, there's many conversations, there's many new things happening to your body. I usually like to remind my patients that we technically haven't done anything. All we're finding is very, very creative ways to tell you everything's okay. We do an ultrasound just to know where we are during the pregnancy. We do the blood work to just get a baseline to make sure everything's okay. We do the carrier screening to make sure that everything's okay. And if something is not okay, we're able to course correct. And that is a similar theme that you'll see throughout your prenatal care visits. All we're doing is finding ways to tell you everything's okay, and if not, to intervene appropriately. Thank you if you made it to the end of the video for watching the full video. If you found this useful, please like and subscribe. If you think one of your friends would find this video helpful, please share. Thank you and see you in the next one.